Okay, commissioners, by the network clock, we're at 2:55. Are we ready to reconvene?
We are ready to go, Madam Chair.
Okay. Commissioners, we have two major items on our work session left to do. I would propose that we would move forward with items number 3 and 5. Item number 4 is being moved to September 14th. That's the library's item. And that after we do items 3 and 5, we then come back to board and leadership communication. Is that acceptable? Okay. All righty. So now we're going to dive into the presentation review of new information regarding the multi-use path options for the Thompson Road Kinney Saltzman project. Oh, and for the sake of the recording, I will say that this is Chair Catherine Harrington, and I'm joined by a full complement of commissioners, Commissioner Jerry Willey, Commissioner Nafisa Fai, Commissioner Roy Rogers, and Commissioner Pam Treese. Turn it over to you, Mr. Roberts.
Great, thank you, Madam Chair and Commissioners. So we're here this afternoon to walk through a follow-up work session to something that we presented to you back in February of this year. And ultimately the purpose of our bringing this project forward to you is consistent with Board Resolution and Order 17-2, the Board and guidance on the selection of bicycle facilities for county-funded capital projects. At that time, the board's policy preference was stated as encouraging separated or protected bicycle facilities on major county roads. And so we bring forward different design options for the board prior to a 30% design review for projects, including at least one option that provides a separated or a protected cycle facility type. And I would note, well, I'll come back to it at a later date. Next slide, please. So today in our briefing, we'll just sort of briefly review project area context that was shared with you back on February 2nd. We'll briefly recap the February 2nd work session and the input we received from the board there. We'll talk about community input that we've received to date. And then we have some additional information that we do want to provide to you relative to arborist assessment and recommendations about some existing trees that are located in this project zone that have been the focus of quite a bit of concern and multi-use path, as was stated at the February work session. And so we'll walk through those briefly with you as well. And then we'll just open it up for discussion, questions, and any input that you have as we look to try to confirm selection of a multi-use path option for this particular project. Next slide, please. So briefly, an area overview. This is located up in the far northeast quadrant of the county. This is up in Commissioner District 2. The project area is the area that you see that's kind of bounded in red lines. And it is essentially a realignment. The project here is essentially a long planned realignment of Thompson Road, which is the blue line, and you can see that it currently has two 90-degree curves on its current alignment. So this long planned realignment would essentially smooth out the curves and connect Thompson Road more directly to Saltzman Road, and then west to the Kaiser West Union intersection. The project itself is located right on the border between CPOs 1 and CPO 7. And then you can sort of identify from the context, probably the map, that most of the properties in the area are primarily residential. However, at this particular location, there are 3 pedestrian attractions, if you will, or sites that we anticipate will generate higher pedestrian demand, and that's the existing Findlay Elementary School that you see in blue, There's a future park site that THPRD currently owns, though they don't currently have a plan or a timeline for when that park will be developed. And then in red at the northeast quadrant of the Thompson Road Saltzman intersection, there's a neighborhood commercial center there with a number of businesses and community-oriented facilities in there. Next slide, please. This photo zooms in on the existing conditions in this location, and unfortunately, because of the orientation, this slide is sort of oriented so that north is about 45 degrees to the upper right. But you can see this existing stretch of roadway was constructed through a subdivision. This was done in anticipation alignment of Thompson Road. So this existing street that was built through the subdivision is currently referred to as Kinney Terrace. It will become the new Thompson Road alignment. And then the current Thompson Road alignment, which you can see at the sort of near the upper left and upper right corners of the slide, will be.
There were 50 or so questions that were asked. So it was a highly interactive session. There were some complaints about the way that the Zoom methodology worked and things that we may consider addressing into the future about knowing who's participating and that type of thing. But I do believe that all the questions that were asked did get answered. So thank you, staff, for that.
Mm-hmm. Yep, and thank you again for the recommendation. It was definitely a good exercise to do that, so we appreciated that, and for your support during the meeting as well. So I did mention that since February, the county retained 2 different arborists who have done evaluations of existing trees that are located in the right-of-way for Kinney Terrace, which will be that realigned Thompson Road. Those trees were planted in 2002 or so by the developer who developed the subdivision on both sides of Kinney Terrace, and the trees have been and are being maintained by that adjacent homeowners association. As I mentioned, we engaged in a couple of certified arborists, and we were asking them really to try to evaluate the health and condition of those existing trees, the project's potential impacts on trees, and then we saw that there's an opportunity to actually proactively address some potential issues with those trees as well. Next slide. So the findings from the arborists were that a number of the trees, and this was a little bit of a surprise to us, honestly, but many of the trees that are in that existing right-of-way are really not well suited to the area or the environment in which they have been planted. For an example, the street tree species that was installed back in 2002 really is too large and has a pretty aggressive rootstock, and that has already led to buckling up the sidewalks on both sides of the road because it has these fairly large surface roots. And that's expected to continue to worsen over time as those trees continue to mature. And then there were additional trees that were installed behind the sidewalk and between the adjacent homes that abut the roadway. And the arborist that looked at those had some concerns about long-term viability of the vast majority of those trees. And they range anywhere from some concerns about existing or potential beetle damage, fungal disease, susceptibility for a large number of the trees that are in the right-of-way there, and then that a number of the trees that were installed were really just planted too close together based on their mature size. So those trees in many cases are starting to crowd each other and compete, and that also, the proximity minimizes airflow that goes between the trees and may also contribute to greater susceptibility for some of the fungal disease that was also noted as a concern. So we think that we have an opportunity, as I mentioned here, to address the concerns with the street trees, and there are about 55 existing street trees, and then again with the majority of those trees that are located behind the sidewalk. Next slide. So recommendations from the arborist. So again, these are broken into 2 categories. One dealing with what we call the planter strip. That's the gap or the planting area between the roadway, the curb, and the existing sidewalk. It's 4 feet wide, and so their recommendation, again, for the reasons I noted before about the roots and the damage to the sidewalks and the ongoing concerns, there are some additional concerns with those trees to provide the space that those trees need to really attain their full desirable maturity and also to help reduce the spread of disease that might occur there. And when we look at the options, there is an option for a 9-foot curb type path. So again, that could preserve more of those existing trees that are behind the existing sidewalk. However, that really wouldn't provide the opportunity to address some of those longer term viability concerns about those trees in the back there. And we have at the end of the presentation, or close to the end, there's a table where we'll try to just sort of look at various impacts of these different options to get all together. So next slide, please. So now I want to just walk us through different options that we've evaluated and looked at that we'll consider. And so there's one that we're calling baseline design, and that's really based on the board direction from February 2nd. That would be the 10-foot wide path with a 4-foot wide planter strip. There's an alternative option 1. There was a constituent suggestion that was submitted to the board, I believe the day before the February work session, which suggested a potential curb tight multi-use pathway. So a path that would be up adjacent to the roadway without the planter strip. And there are 2 subtle variations on that theme that were looked at as well. Next slide. So I've got some slides that we looked at to try to just help provide a little bit of a visual representation of what these different options look like. And so on each of the 3 options, you'll see the top drawing reflects the existing conditions that were there. And I'll just quickly walk through those, but you see that we have on-street bike lanes without a buffer, 4-foot wide planter strip, a 5-foot wide sidewalk, and then about 10 or 10.5 feet between the existing sidewalk and an adjacent hedge at the property lines. And I didn't mention it earlier, but this is what the design standard for the county was at the time that the roadway was constructed. I think it's important to note that back in 2002, this was the county standard. I think our thinking over about preferred bicycle and pedestrian facilities has changed over time. We're in the process of reviewing and revisiting our road standards, and so just to point out that these standards that were in place at the time are not fixed in place forever. Commissioner Willie?
Yeah, it's interesting that somebody commented about why a center turn lane when there's already a center turn lane there. So, but they don't like it and they recommend you take it out, or?
Yeah, and maybe I don't know that I have a great aerial photo that shows it, but there are long stretches of that center turn lane, relatively long sections of that center turn lane, where there really isn't a need to be able to make left turns. There's a need for left turns in the middle of the subdivision, but not really so much on either end of the subdivision. And so there may be opportunities where we could take out some of that pavement and install landscape medians in the middle of the roadway just to help enhance the aesthetics of that corridor.
And
Yeah,
just
that's a good idea. Okay.
And just for clarification, Commissioner Willie, at this point, that road is blocked off at either end. So people aren't using it as a through street and don't use any of the 3 lanes, frankly. Is that fair, Stephen?
Yes, my observation, I've visited the site several times and I see people walking on it much more and riding bikes much more frequently than, there's nobody really driving on it today.
Well, there's no place to go at either end right now.
Right.
So that's why it's not, that's why. So
that's exactly right. And it's a little bit hard to read in this slide. I have a couple of, or an additional slide that I'll try to show you in a plan view what I'm just trying to describe here. But with this baseline design option, you'll notice that we now have a buffered bike lane on street. So that's a little bit of an enhancement for the folks who choose to ride on street. We would retain the 4-foot wide planter strip, but install a tree species that's more suited for that particular environment. And then there's about 5 feet behind the proposed path here. And so we would also try to look at incorporating something similar to street trees on the back side of the sidewalk. And go ahead and go to the next slide, please. I think this tries sort of helps depict that maybe a little bit more clearly. So we'd have trees on both the planter strip or the roadway side of the path, and then on the home side or the back side of the path. And in the plan view, you can see that the intention would be to sort of stagger those trees so that you have a row of street trees, and then in between every street tree, you'd have a tree planted behind the pathway. So the idea there is that we're providing tree canopy and shade on both sides of the path. And then we're also helping to achieve, I think, a more consistent, uniform tree canopy buffer, if you will, between those adjacent residences and the roadway itself.
But this is the option that would have the most trees. At this juncture, I just want to remind us that we have 4 more slides to go over towards the goal of having the presentation within a half an hour, so we have enough time for commissioner conversation from the 5 of us.
Agreed. Thank you. Next slide, please. And then the next 2 options, as I mentioned, are really subtle variations on the same theme. They're curb tight pathways. So you can see in this case, there is no planter strip provided between the roadway and the multi-use path. And these options would preserve or allow the preservation, I should say, potentially of more of the existing trees that are behind the pathway. However, again, these options don't really provide the opportunity to sort of proactively address some of those concerns with those existing trees located in that zone there. So this version is a 10-foot path. Next slide, please.
Hey, Stephen, real quickly, what's a normal travel lane? Is it 11 feet or 12 feet?
So at the time the roadway was built, 12 feet was the standard. And as of today, that is still our standard. But most of our projects that we're developing right now, and as we're updating the road standards, we are using 11-foot lanes on a much more regular basis.
Okay, thank you.
And I think in this particular context, given that we're trying to help keep the vehicular speeds at 35 miles per hour, which will be the design and the posted speed through here, reducing those lane widths can help a bit with that. So. Next slide, please. So there's a version of this slide in your staff report as well, and I won't spend a whole lot of time on these, but I think, again, what we've sort of summarized is that with the baseline design or the version on the left here, we would retain a planter strip. In any of the 3 options, based on the arborist recommendation, we'd be removing existing street trees. With the baseline design, because we would have a planter strip, we'd be able to actually place 55 trees back in the planter strip, and then an additional 55 or so trees in the area behind the sidewalk. And these are approximate numbers at this point. We don't have a final design, of course. So as the chair was mentioning, this option, the baseline, actually would result in the highest number of total trees overall at the completion of a project. So somewhere on the order of about 110 trees, 55 on either side of the path. The alternatives 1 and 2 that we mentioned, again, no planter strip, so all of those 55 trees would be removed, and then we would have some additional trees that would, at a minimum, need to be removed just physically to accommodate the pathway. And then again, I think there would be additional trees that we would probably want to evaluate for either removal or some other sort of care behind the sidewalk. And so again, rough numbers here. With alternatives 1 or alternative 2, we would end up with somewhere between probably 65 and about 90 trees total would remain after the project was completed. Next slide, please. And so that brings us to opportunities for questions and discussion.
Planted improperly, they grew too close together, they have disease, but it's hard to see those go. And the other piece that both the chair and I heard was, if you're going to replace these, don't replace them with skinny little saplings. Replace them with something that has got a little bit more girth to it to get started. The other thing that I really want to emphasize is that alternating of the trees creates what the community is interested to in the canopy effect over the sidewalk. And that canopy, if it happens this way from either side of the sidewalk, allows for more airflow, which according to the arborist is one of the factors in the disease that the current trees are experiencing. The other thing that I don't think we really talked about enough at the August 31st meeting is that the tree design goes all the way up to the intersection across from Findlay School and comes all the way down. And that is not what the community has at this point. They just have what was planted on Kenny Terrace. So there's also concern about the lack of need for a 5-foot sidewalk. My sense is that we are here to plan for the future. We've got a design that we've accepted as the design that would look forward across the county as the county ages. And I think it's important to stay consistent with that. But this is a very emotionally charged issue. And I want to recognize that. I want to extend my appreciation to the community members that have reached out to me and to all of us in relationship to this issue. The other thing that I really want to say to all of us is that this is not going to be the only time we see this issue. We are going to be faced with these issues as we work through the entire county. So I think it's very important to really think clearly about what our philosophy is here and to be consistent as we move forward.
Thank you, Commissioner Treese. Any other commissioners?
Yeah, Stephen, what's the source of funds for this project?
This project is funded under the Major Streets Transportation Improvement Program Bonding Cost Sharing Program. So it's a combination of MSTIP funds and County Transportation Development Tax funds.
And what's the queue on it as far as the misstep allocation?
When you say the queue?
Well, you got lots of projects in the MSTIP that are yet to be built. Is this one all
This was approved.
Yep.
But when you build them, it's very different when approved.
Yeah.
When is the funding on this one available?
Yeah, so it's in the queue. It's in project development now, so the funding is available, and we're looking to move the project forward.
Let me poke at it again, because I'm not getting. If you had everything today, when would that funding be available? I'm sorry, Chair, that this is frustrating you, but I want to know the answer.
I think if I'm understanding the question, I think we're saying the funds are available now. We're ready to move.
I didn't know you had the piggy bank available, but okay, thank you. That tells me a lot.
Okay.
Approved projects have funding allocated for them. Otherwise, they're not yet approved in a funding allocation plan. They just move through the phases of project development towards the construction and getting into the queue for funding.
I'm aware of that, and I think it's a good point, but there's always this is like Social Security. There's money coming into the bucket. And so if you tell me you got $6 million sitting there for this project, that's fine. But normally you're getting off taxes over a stream, and you're planning these out. So I understand things may be approved and you got them planned. I just want to know when that project would hit. So, all right, thank you.
The other thing I'd like to add, it's hard to keep your sight on the fact that this is the Thompson realignment. You know, we're involved in trees, we're involved in multi-use paths, that type of thing. But the importance of getting this done for that Thompson alignment is the reason that we're having this discussion. Any other conversation from commissioners?
Like Commissioner Treese, I remain in support of the 10-foot baseline design as it renders the maximum opportunity for the community members, whether you're in a vehicle passing through or live in the neighborhoods, to take advantage of all these amenities that are available, as well as concern for trees and the aesthetics that provides to the community. So we have about 5 more minutes before we need to move on. Yes, sir, Commissioner Willie.
Well, Commissioner Trish just called that the Northwest Thompson realignment. So I'm assuming somebody has done traffic counts on that road, because just in looking at it from the 10,000 foot level here, all of that traffic that is currently going up and around that neighborhood is now going to go through the Kinney Terrace realignment. So I can understand their concerns about traffic when they had a 3-lane road with bicycles on it. Now they're going to have a 3-lane road with cars on it.
Yep. And it was on the county TSP when their neighborhood was developed and they moved there. Yep.
Yeah. Well, so I'm assuming we've done traffic counts, Stephen, and I mean, is traffic going to be a huge concern going through that?
Well, the existing traffic volumes are about 7,500, maybe just a little bit lower than that, vehicles per day. And this roadway is actually an arterial. That's sort of on the lower end of traffic volumes for an arterial. As we looked ahead out through 2040 or so, we are anticipating pretty significant growth in that traffic volume over time, just as additional development continues to occur up in the county, and we just have background growth in traffic demand generally over time. So we are expecting that it will uptick, and that sort of reinforces the importance, I think, of getting traffic off of that existing alignment that has the 290-degree curves and getting them onto a somewhat straighter, safer alignment.
But it won't take all of the traffic off because of the local access piece there correct. As well.
On the old Thompson alignment,
yes.
Correct. Yeah.
Okay, I'm good. Thanks.
So staff, you're looking for a thumbs up to move forward with an option. The current one on the table is the baseline design. Okay.
All right, great. Thank you so much.
Thank you for all the work that you've done with this new information, community engagement, and all the graphics to bring this to clarity for all of us. It's great.
Thank you.
Okay, I know we've had a really long day today. We do have one other item that we need to get to on a timely basis based upon fiscal financial requirements from the department. And that would be the review of the Community Corrections 2021-23 Biennium Plan. I'll turn it over to Ms. Tanya Angie and her staff.
Thank you, Chair Harrington, and I would like to introduce Joe Simic, who's the acting director of Community Corrections as Steve Berger is out on leave. So, Joe, I'm going to turn it over to you.
Okay, thank you, and good afternoon, Chair, board members. So as Tanya said, I'm here to do a presentation, an overview of our 2021-23 biennial plan. I know most of you have seen this or seen at least a version of this and had an opportunity to ask some questions, but going through this, if you have questions, feel free to chime in. I don't know if I'll be able to see hands raised or not, but please go ahead and feel free to ask. Next slide, please. So on the agenda in this plan is to go over 5 strategic goals that the department has. I'm also going to touch on our justice reinvestment, and specifically 2 programs that we have that are designed to reduce our prison commitments from Washington County to the Oregon Department of Corrections. And then an overview, an update of our 3 divisions in the department programs, which includes our practice model, the Community Corrections Center, and then parole and probation. Next slide, please. So our ask will be for board approval of the 2021-23 biennial plan. We're currently scheduled on the consent agenda for September 21st. There's a typo in there. I think we had the wrong date, but it is the 21st. I will be available if there's questions then. Next slide, please. So our mission, we enhance community safety by promoting positive behavior change. We work with people long-term. Our staff are trained to provide motivation for individuals to see the need for change and to want to change their behavior. And then when people are ready for change, our staff provide them the tools and the supports necessary for them to make those changes. Ultimately, our goal obviously is to reduce recidivism in the community, but we also make it a focus to make those people that are on our caseloads, make them feel valued in the community, make them feel a part of our community, not just committing less crimes. Our values, we're evidence-based. We pay attention to research. We implement programs that are evidence-based. We value our change agent relationships so that we know that, research tells us that the strength between the relationship of a probation officer and their client has a direct effect on their motivation and compliance. So we talk to our staff about establishing a professional alliance with the clients that they supervise. And finally, we're respectful and supportive, but we're also firm and fair. Next slide, please. Moving on to our strategic goals. We're prioritizing equity, diversity, and inclusion in this plan. We will align our current practices with the county EDI initiatives and center all of our practices within EDI. That includes developing our internal EDI consulting team. We're participating in Washington County's EDI Leadership Council and subcommittees to ensure our department practices align with countywide initiatives. We're implementing the limited English access plan. And finally, collaborating with human resources to deepen diversity in staff recruitments and retention. And I'll touch on that here in just a couple of slides. Behavior change. So through our Community Corrections Center or Community Corrections Practice Model, we will work with the clients under our supervision to reduce recidivism and their criminogenic risk. We do that by aligning supervision strategies with criminogenic risk need and responsivity, providing cognitive behavioral interventions and treatment as needed, building rapport to enhance client motivation, and finally working with client support systems, their families, and the community. Next slide. Accountability, we will hold our clients under our supervision accountable for their actions. So we align our supervision intensity and access to services with criminogenic risk need and responsivity. And we utilize effective rewards, interventions, and sanctions. Resource management services and resources will be sustainable, cost-effective, evidence-based, and performance-based. So we collect and use accurate data and receive evidence to make resource allocation decisions, implement continuous quality improvement process, and recruit, hire, and develop and manage our staff and volunteers with the right core competencies. And finally, commitment to victims and the community. We will respect and address victims' rights and needs, contributing to community reparation. We do that by providing culturally appropriate services to enhance our accessibility for victims and community members. Collaborate with criminal justice agency professionals, advocates, and the community on meeting victims' needs. Provide victim services and support community efforts in providing services to victims and their family, and make all reasonable efforts to collect victim restitution and court costs. Next slide, please. So this is an overview of our race ratios for staff. And what I want to do is just kind of focus on the column on the right-hand side, which is the grand total. The other slides are just, or the other columns are just splitting out by gender. I mentioned earlier working with human resources and making sure that, it's a goal of ours that our staff race ratios reflect the community and the community that we serve. And so the one area that to me we stand out is those of our staff that identify as white is 77%. Those that identify as Hispanic or Latinx at 11%. And for context, our county demographic, it shows a 65% white, 17% Latinx, but the clients that we serve, 70% are white. And Chair, I think I sent this to you earlier. 70% are white, 19% as Latinx. And so there's obviously a gap there. And so I've already
actually in your report, page 33, as well as page 116 of 144, each had data that aligns with this. So yeah, I wish I didn't have the chance to read the report before we met. So job well done.
All right, well, good. So, but we, it's an area that we continue to focus on, and we will continue to report on over the years, I'm sure. Next slide, please. This slide is a visual. It shows that what our caseload sizes on the parole and probation side have gone through during COVID or since COVID has started. And you can see going back to 2017, we've had an uptick each year in the number of people that we supervised over the course of the year. When the pandemic hit, the court shut down, we've seen a reduction in our caseloads and the total number of people on supervision. We anticipate that 2021, that 2,800 mark was a snapshot from last month. It's not cumulative for the year. We'll continue to grow throughout the course of the year, but we're going to still be less than where we've been even in the previous year. But we are starting to see an uptick in our intakes coming from the courts. And now what we'll be doing is paying attention to what the populations are looking like as that number starts to grow. There's been some changes that will affect probably our populations. Specifically domestic violence, family violence, as well as our drug caseloads. Next slide, please. So there's two programs that we highlight as part of our justice reinvestment program. The first is short-term trans leave. So that's a release from prison up to 120 days early before an individual gets placed onto post-prison supervision. So going back over 7 years in Washington County, we've seen a 91% success rate. So 91% of those folks are successfully completing that period of short-term trans leave. That equates to a prison cost avoidance of over $2.5 million for the State Department of Corrections. So we internally, we have one probation officer dedicated to prison transition. He doesn't just work with short-term trans leave individuals, he works with everybody being released from prison. We recognize the importance of transitioning people from custody back into the community, and especially those that have been incarcerated for up to several years. So our goal is to connect with clients prior to release. Fernando Milan is our PO that does our prison transition. He's working with people, try to get in touch with them up to 90 days prior to their release, making sure that they have all of their questions answered, they know who to report to. We've got transportation in place, housing in place. And like I say, Fernando works not just with short-term trans leaves, but everybody being released from prison in the department. In 2020, so in last year, we had 14 different institutions that we worked with, 512 prison releases. And out of those 512, RPO had face-to-face institution meetings with 68 people and 388 telephonic reach-ins. And I think I've mentioned before, in a normal year, a non-COVID year, you're going to see those numbers flipped a little bit. He's going to do the vast majority of his reach-ins face-to-face in the institutions. Next slide, please. The second part of our justice reinvestment is our IRIS program and our IRIS team. IRIS provides the court the enhanced community supervision alternative to prison, utilizing the concepts of risk, need, and responsivity. The first thing we do with any IRIS referral to us is to complete a pre-sentence report for the court. It also goes to the DA and the defense attorney. That report includes a risk assessment, so a static risk score, the public safety checklist, as well as a risk needs assessment, the LSCI or WARNA. We also do a point-in-time assessment to gauge motivation for that individual, as well as the Texas Christian University drug screen. And then we also provide any additional information that PO has gathered in their interviews with each client. Then the probation officer submits a report to the court, and we make a collaborative recommendation for program assignment. So we're not necessarily making a recommendation for community supervision or prison. We're just providing the information to the court to make that decision. But we make a collaborative recommendation with the district attorney's office as to the conditions that would be necessary if this person is placed on supervision, and then which program is best designed for them. And IRIS is the primary program. That's where the majority of our clients will go. But drug court, family sentencing alternative pilot, our veterans court, and mental health court are also options if that's a better fit. We would recommend one of those programs. And then second look, those are individuals that were convicted as juveniles. They've done prison time at OYA, and now they're eligible for a second look release or an early release from prison, still having prison hanging over their head should they violate and get revoked. So those individuals we also put on our justice reinvestment team. Next slide, please. Defining IRIS recidivism. So we define recidivism as any new conviction, felony or misdemeanor, within 3 years of completing IRIS. That's 3 years completing supervision, which is different than the state's definition of recidivism, which is just 3 years following being placed on supervision. With that definition, IRIS program has an 85.5% success rate, so a correlating recidivism rate of about 14.5%, which is pretty remarkable when you look at the statewide average, the Washington County average, the metro average is all up around 40% or the lower 40% for recidivism rates. So it really speaks to really the quality of work that these POs can do, and then the outcomes as a result of that. Next slide, please. Moving on to our practice model and programs. Next slide. So since 2016, the department has been applying implementation science to all of its practices. This formula shows the conditions necessary for optimal outcomes. So it starts with evidence-based leadership. All of our supervisors, managers have gone through not just leadership training, but coaching training as well. And we meet with all of our staff individually monthly for our monthly coaching. Effective intervention, so using evidence-based programs as well as practice-based evidence, which involves continuously reviewing and refining our practices. And finally, effective implementation strategies to ensure that we're applying the implementation drivers in order for us to be successful. So we have our implementation team, our steering team, and other task teams that are represented by staff at all levels of the entire department. And so all of that gives us our best positive outcomes. Next slide, please. So our practice model is broken down into 4 essential work groups. We have our behavior change work group that includes probation officers and corrections counselors down at the center, our administrative support group, leadership group of supervisors and managers, and then our security group, which are the corrections specialists down at the center. And then those embedded in all of our practice model with all of those groups are general organizational development and wellness to make sure that our staff are healthy and well taken care of. In the next biennium, we're going to revise this program to center EDI within all of those different areas of practice. Next slide. So continuing with our practice model, our approach includes a focus on engagement and change readiness for the clients that we're supervising as well as for our staff. We provide evidence-based leadership. I mentioned the coaching and leadership training that our leadership team has gone through. We strive to utilize practices that are supported by research and continuously improve them by testing them in the field and then refining as needed. And we use our data dashboards to collect quantitative and qualitative data to help us make informed decisions. And we'll be centering all of our practices around EDI and continuing to promote feedback loops that help everyone stay connected, informed, and involved. Next slide, please. While our approach for years has been to ensure the equity and inclusion of all staff and roles, we're continuing to focus our efforts on to center EDI and keep it at the forefront of what we do. We've been developing our internal EDI consulting team. In addition to that, we have many of our members throughout the department represented on the array of countywide EDI committees. And over the next biennium, we'll be focusing on centering EDI in all of our practice. That includes the recently conducted leadership assessment. We included EDI as a component of that assessment and received good scores from our staff on our focus in that area. Using data dashboards to help us explore potential racial biases and impacts and help us monitor progress. And finally, in the next biennium, our EDI team will help us review our practices, policies, and procedures so that we further enhance equity across the department and to those that we serve. Next slide, please. The Counseling and Victim Services Program is embedded in our programs division and continues to serve the community with free mental health counseling and victims advocacy. In the last year, CVS has developed telehealth counseling and advocacy services, and we expect to retain that ability moving forward. CVS typically has 4 master's level student therapists who provide around 4,160 unpaid service hours to the community each year. Next slide, please. So moving on to the Community Correction Center. As you're aware, the Community Correction Center is a 215-bed minimum security transition facility. It's currently operating at a cap of 96 beds because of the COVID restrictions. Oh, next slide, please. Getting ahead of us. This slide is showing programs offered at the center. I'm not going to go through each one of them individually, but because of all of the restrictions related to COVID, the programming at this point is limited. And so not all of these programs are going to be available, but they will be post-COVID. Next slide, please. Core Correctional Practices instructs workers on a core set of skills needed to support cognitive behavioral programming. Training is designed for the direct care security staff and the treatment staff. Core Correctional Practices is the evidence-based application of our practice model for staff at the correction center, the security staff at the correction center. It's an evidence-based program out of the University of Cincinnati that all staff have been trained for. Specific topics include relationship skills, effective use of enforcement, disapproval and authority, pro-social modeling, cognitive restructuring, social skills training, and problem-solving skills. Next slide. This is showing our closure data going back several years. And you can see on the very right-hand side, that column for 2020. I don't know if you can see the numbers down there, but there's been such a reduction in numbers. But I would focus then on the percentages. And you can see that for individuals in the center going back several years, very few are arrested for new crimes. In the last year, it was 0%, but typically it's not over 1%. We had 1% escape, which means they walked out of the facility without permission. 2% committed unauthorized departures, so they left on a pass and they didn't come back. 8% committed rules violations, which means it was a serious enough violation or repeated violations that they got returned back to jail, returned back to full custody. And 90% of everybody in the center during the calendar year successfully completed that program and will release time served out of the correction center. Next slide, please. Moving on to parole and probation. Next slide. This is our division structure, or at least all of the specialty that we have embedded within parole and probation. Most of these have been in place for a number of years. I did want to highlight a couple that are fairly new. to the department. We have the family violence. We have the family violence caseload. We're likely to add a family violence during the course of the next several months. We've worked with the district attorney's office to develop a family violence package that the court is using. And so our domestic violence involves partner-to-partner violence, but family violence is then anything else within the family. You know, it could be a parent with a child or siblings, that sort of thing. So that's fairly new to us. Female supervision, gender-specific supervision was implemented here in the last couple of years. And then finally, Veterans Court. That's new, not just for us, but for the county as a whole. And so we have one probation officer that supervises the Veterans Court clients, and then is a part of that Veterans Court team. Next slide, please. Risk, need, responsivity. I've mentioned this before. It's embedded throughout the plan. Risk, need, and responsivity. This is the model that is really foundational in what we do on parole and probation. The first principle is risk, matching the level of supervision and services to the client's risk to reoffend. So we know that we're supposed to be, and we need to be focusing our supervision and services to those that score medium and high risk in the community. So the first thing that we do is use a static risk tool, the public safety checklist, when we get a new referral into our office. If they score low, they go to a low supervision caseload. When they score medium or high, they go to one of our level 1 field caseloads. Next then is the need principle. So those level 1 field POs are assessing each individual. That's the LSCMI or the WARNA, and assessing criminogenic needs, and then they target interventions to address those needs. So what is the behavior that's driving someone to get them put on supervision? And it's oftentimes a lack of family supports, you know, associating with pro-social or pro-criminal people, impulsivity, those things. So we identify what's driving someone's behavior, and then we target a case plan around those behaviors. And finally is the responsivity principle, maximizing the client's ability to learn from a rehabilitative intervention by providing cognitive behavioral treatment, and then tailoring the interventions to the learning style, motivation, abilities, and strengths of that individual. So it's not a one-size-fits-all approach. If somebody gives a third drug use on a probation, the intervention might look very different based on the level of motivation, based on other factors that may be in place. So it's not a one-size-fits-all approach. It's very much tailored to that individual and their individual needs. Next slide, please. These are the benchmarks that we track when we close individual probation or parole files. So we're asking POs to track 3 things related to criminogenic risk factors. Whether or not they're employed or they have constructive activities, and that could be full-time parent, full-time schooling, other constructive activities. Whether they have pro-social supports in place. So do they have at least 2 to 3 pro-social supports or pro-social activities? It could include even AA or NA. And then did they benefit from treatment? So not just did they complete treatment, did they actually demonstrate that they benefited from the treatment program they went through? And so if you look at those bar graphs on the left, that's 2019 and 2020. Those are all the people that successfully completed supervision, whether it's post-prison or probation. And you see the percentage of them, 90% or so, have all of 3 of those factors in place when we close them out. On the other side, those 2 short little bar graphs on the right-hand side, those are the people who were revoked off of supervision. And so when they're revoked off supervision, did they have those in place? And you can see that, you know, just a stark contrast and difference. And so this is why, and we share this with staff, essentially this is why it is that we focus on pro-social activities, pro-social supports, and treatment, because it really does affect change. Next slide, please. That's it. Questions from any of you?
Well, if you could also just go over the next slide on your request, because you may get some questions based on.
All right, next slide, please. Thank you. So again, our request is for the board to approve our 2021-23 biennial plan, and it's scheduled for the consent agenda September 21st.
So commissioners, do you have any questions or comments?
I have a comment. Thank you, Joe. That was a nice presentation, the same one that you gave to each of us individually, I suspect.
Yeah.
But,
a little shorter version of it, but yes.
yeah, you have my vote for your request. I think that it's pretty obvious for a long time that community corrections, as we carved it out many years ago, is to do exactly what you're doing. And I think an independent department like yours, with achieving the results that you achieved, is a real feather in your cap, and not just you because you're new, but those who appreciated you and those who work around you. So
Yeah.
Thanks for spending the time.
Well, thank you, and I did appreciate the opportunity to present this ahead of time. I think it did help, and I want to thank everybody too, because everybody that I met with individually was nothing but supportive. So I appreciate that, and I think everybody's been able to recognize it's really the staff that are out there doing this work day to day at the center, out in the field, that do really quality work, and they impress me every day.
Any other commissioner comments? Go ahead, Commissioner Willie.
Yeah, thanks, Joe. This information, again, as Roy pointed out, I've seen this information a couple of times, but it's still absolutely astounding to me, the success rate that we have in this program, yet how hard we have to fight for continued funding from the state for this program. But we will persevere. A lot of it, quite frankly, I think is information. I think they are not aware of this program nor the success of these programs. So shame on us. We need to do a better job of marketing and certainly encouraging those people who are in charge of the checkbook that of the success rate we have. So great presentation. Thank you for doing this. And the public safety committee that I'm on, also what a great group of people that is. Everybody is so dedicated to this. So I'm really impressed. And I think anyone outside of the county electeds and the county staff that would see this, I think they'd be impressed as well. So let's keep up the good work.
Thank you. And it is a systems-wide, effort. And I will say, speaking of, the sheriff and the DA, and I've been here enough years to know, the quality of our relationships right now has never been better. And the support that we receive, outside of our little department, but the support that we receive, throughout the entire criminal justice system here in Washington County is great. Thank you.
Any other commissioner comments? Okay, I'll close with thank you, Joe, to you and the full team. I also want to bring to life something that I did have. Well, I had the opportunity to read the report after our meeting. And something that the report brought forward that I don't think got mentioned in the presentation today, and I don't think it was in the briefing either, was on page 25 of the report, talking about how in this next biennium, the programs division will be working with the supportive housing services team because stable housing can be a major challenge to justice-involved individuals, especially those suffering from mental illness and those who have been convicted of sex crimes. And I just want to say I thank you in advance for doing that work because otherwise it is a need that might not otherwise have a voice.
Right.
So I really appreciate your teams following through on that. And I just want to say, we are one of only a few counties in this state that invests in community corrections. I greatly appreciate the decision on behalf of boards of commissions before me who chose to invest in building a community corrections center versus expanding the jail, and funding these programs so that we were breaking that cycle of people just continuing to commit crimes, do time, commit the crimes again and again and again without the opportunity of changing their behavior. That's really what this program is all about. And we have an amazing team here in Washington County doing this work to ensure that we have even safer communities than we would otherwise. And also that we are not losing that human capital that is part of our community. So thank you, Joe. Please give the team my best regards on a job well done. And I join my colleagues in being thumbs up in moving this forward through the September 21st meeting.
All right, thank you very much.
Great. Stay healthy. Thanks very much.
Will do. Thank you. Have a good rest of your afternoon.
Thank you. So commissioners, I would ask if any of you, we did have board communication last Thursday at our roundtable. I, for myself, would only be commenting on further work of Friday and then a Labor Day weekend leading up to today. So I don't know that we have much of a need for board communication, but we do have a few minutes for that as well as leadership communication before we adjourn to next Tuesday, the 14th. Commissioner Treese, go right ahead.
I just quickly want to draw your attention to the fact that the draft paper, the Consolidated Annual Performance and Evaluation Report, is out. I just want to make sure that you know that in relationship to CDBG, ESG, and homes. So this is the evaluation piece for the year that ended or that started in July and ended in June of this year. So it's on our website. You should have a communication about that. Just a heads up.
So I don't think I've seen anything yet. Could you or Megan please help us?
I will forward it to you.
Terrific. Thank you. Anything else, commissioners? Okay, leadership communication, Ms. Angie.
So thank you, Chair Harrington. Board, I will not be providing a COVID update because I think we covered that earlier in today's conversation. Just from a weather standpoint, we do not have fire danger currently. Through Wednesday, you will more than likely see hazier skies. However, I have been informed from Health and Human Services that there are no air quality concerns at this time. But just so you are aware, if you have community members asking about the haze. And that concludes my update.
Mr. Carr.
Thank you, Chair Harrington. I have nothing to add, although I will note that my bar admission has come through, so I've removed the county council designee from my name.
Yay! Thank you for bird dogging the state for that. Really appreciate it. Diane Taniguchi-Dennis, Clean Water Services CEO.
Thank you, Chair Harrington and Board of Clean Water Services. You didn't get our COVID updates. I'll just give you a quick one. So Clean Water Services is currently 75% vaccinated. There's 1.25% that have a medical exclusion, 1.25% that have a religious exception. So there's 22.5% that we're still tracking. Of that 22.5%, 1.75% are partially vaccinated. So that leaves 20% to 20.5% that are still unknown. So we're working with the team. The team's been really great at sharing information. Right now, our operational plan is working. We're still in stable operations. So far, we have 12 close contact exposures. Of 2 of them, they were positive cases in households, and with one was with a close family member. But out of all of those, only 1 turned out to be positive. So we're still doing well, and the team is doing well, even the ones that are ill. So thank you for the board for all of your support, and I appreciated the conversation today.
All right, just An additional late breaking piece of information, Governor Brown and a few of her direct reports had a press conference today with regard to back to school. I didn't see anything in that message that had any new information. It was yet again another appeal for us to get vaccinated, wear your masks, and to continue limiting social gatherings. Not sure if I can last much longer with regard to that. So there's that. So, okay, anything else for the good of the order today? Whew. Long day. We covered a lot of topics and a lot of ground. Thank you very much for hanging in there and doing this incredible work on behalf of our community. Stay well. Thank you. Bye-bye.